Is recognized for 1 hour.
Thank you, Madam Speaker. For the purposes of debate only, I yield the customary 30 minutes to the gentleman from Texas, pending which I yield myself such time as I may consume. During consideration of this resolution, all time yielded is for the purposes of debate only. I ask unanimous consent that all members be given 5 legislative days to revise and extend their remarks.
Without objection.
Madam Speaker, yesterday the Rules Committee met and reported a rule, House Resolution 1191, for 3 measures. First, it provides for consideration of H.R. 4176 under a structured rule. The rule self-executes a manager's amendment, provides 1 hour of general debate, equally divided and controlled by the chair and ranking member of the Committee on Oversight and Reform, makes in order 3 amendments, and provides a motion to recommit. Second, the rule provides for consideration of H.R. 5585 under a structured rule. The rule provides for 1 hour of general debate, equally divided and controlled by the chair and ranking member of the Committee on Energy and Commerce, and makes in order 1 amendment and provides a motion to recommit. Third, the rule provides for consideration of H.R. 7666 under a structured rule. The rule self-executes a manager's amendment, provides 1 hour of general debate, equally divided and controlled by the chair and ranking member of the Committee on Energy and Commerce, makes in order 17 amendments, and provides en bloc authority and a motion to recommit. Finally, the rule extends recess instructions, suspension authority, and same-day authority through July 13th, and any requested roll call votes on suspension bills considered from June 21st to June 24th may be postponed through July the 15th. Madam Speaker, I yield myself such time as I may consume. I stand
the gentlewoman is
in
recognized.
Support of, thank you, Madam Speaker. I stand in support of the 3 bills in this rule. H.R. 7666, the Restoring Hope for Mental Health and Well-Being Act. H.R. 5585, the Advanced Research Projects Agency Health Act. And H.R. 4176, the LGBTQI+ Data Inclusion Act. I want to start by thanking Energy and Commerce Chairman Pallone and Ranking Member McMorris Rogers for their work crafting a bipartisan package to tackle the growing mental health crisis in our country. During the COVID-19 pandemic, we've seen a dramatic rise in global mental health illness associated with anxiety, depression, and collective grief. In my state, almost 45% of North Carolinians reported symptoms of anxiety or depression in February 2021, with more than 22% unable to get necessary care, largely because of prohibitive costs. Almost 130,000 children ages 12 through 17 in North Carolina suffer from adolescent depression. Multiply that nationwide. More than half of the children in North Carolina did not receive any care in the past year. Once they reach high school, these children are twice as likely to drop out of school as their peers. These statistics tell just part of the story of families disrupted, education delayed, and the barriers facing Americans striving to achieve their full potential and well-being. Congress has a duty to address this crisis with the same urgency with which we passed COVID-19 legislation. Today, we are doing just that with H.R. 7666, the Restoring Hope for Mental Health and Well-Being Act, which will provide improved access to health care for mental illnesses and substance abuse disorders. This legislation boosts compliance with mental health parity laws, supports mental health care through telehealth, and reauthorizes key programs that fund mental health services, all deeply needed by our people. This rule also includes H.R. 5585, the Advanced Research Project Agency Health Act, ARPA-H. For decades, the United States has been the leader in biomedical research around the world. However, our country has recently shown signs of slowing in this sector. Promising research opportunities are put on hold due to high cost, complex coordination, long wait periods, and many other factors. My state of North Carolina became the first state in the country to have a state-supported entity dedicated to promoting growth of the life sciences industry after the creation of the North Carolina Biotechnology Center in 1984. In my district of Wake County, the Research Triangle Park stands as the largest research park in North America. ARPA-H will have profound influences in North Carolina's economy and the national economy, and stimulate the development of breakthroughs in health research that will benefit millions of Americans. H.R. 5585 will authorize $500 million each year for the next 5 years to support ARPA-H and fund groundbreaking research and development to continue saving American lives. Finally, this rule includes H.R. 4176, the LGBTQI+ Data Inclusion Act. Most legislators agree that good policy should be evidence-based. Our government collects demographic data to ensure we can identify whether certain groups of Americans are facing obstacles to the equal opportunities they need to thrive. However, federal agencies are not currently required to collect demographic data on sexual orientation and gender identity. We need this data to know how to address issues faced by the LGBTQI+ people and combat discrimination. In 2019, UCLA found that nearly 1 in 4 LGBT adults in the South, including in my state of North Carolina, live in poverty, a rate higher than the overall poverty rate in the United States. LGBTQI+ youth, in particular, face high levels of homelessness and are at a greater risk of depression and suicidal thoughts than their peers. With good data, we can implement programs aimed at eliminating these disparities and help members of this community reach their full potential. As Kathy Renna of the National LGBTQ Task Force says, if we don't get counted, we don't count. This community is asking to be counted. Our nation has already gone through the poor policy of don't ask, don't tell. We now have a responsibility to reverse the effects of this policy to help members of the LGBTQI+ community live as their authentic selves. We can do that by allowing individuals to voluntarily disclose their sexual orientation and gender identities. In other words, by asking and letting them decide to tell. I urge support for the rule and the 3 bills it contains, and Madam Speaker, I reserve the balance of my time.
The gentlewoman from North Carolina reserves.